And when I'm on a shoot, the makeup artists are like, oh, are you tired? Or like, oh my gosh, like you look so tired because your dark circles.
Hello everybody, my name is Tony Medina, CEO of Soul Guide Medical, and today I'm here with my good friend Sydney. Hi Sydney.
Hi, how are you?
I'm great. How are you?
Tired, but I'm looking forward to this.
Great.
Yeah.
You contacted me a while ago asking for some help. Can you explain to everybody what you wish to have?
So I don't know if you can notice, but I have quite dark under eyes and they're quite puffy as well. And so even if I sleep well, I look tired. And when I'm on a shoot, the makeup artists are like, oh, are you tired? Or like, oh my gosh, like you look so tired because your dark circles are. No matter how much they put on makeup, because they can only put on so much before it looks too cakey on the film, it's an issue. So I really would like that corrected. I would like not people coming up to me like, oh, you look so tired, are you okay? All the time when I am feeling okay.
If you watch my video from years ago, I had the same thing. It's been 5 or 6 years since I had it, and last night I really didn't sleep very much, but it's still okay.
Yeah.
Relatively speaking, compared to 5 or 6 years ago, it was really, really bad back then. Like I looked like a hollowed out panda. But in her case, she has a little bit of pandaness going on, but she's got fat clumped up. And unfortunately, if your fat is clumped up, no amount of makeup is really going to help. The best way to fix it is to first reposition the fat, remove any extra fat that is unnecessary, and graft extra fat, usually from the middle of the belly button or the back of the thigh, and reposition that new grafted fat. The reason you most likely need to inject new fat is because if you just reposition the old fat, it's not going to look as good or cover as much. Another option that people often ask about is filler.
Okay.
Have you heard about filler?
No, I haven't.
So filler is an option, but I don't really like to put filler under the eyes too much. If you do it once, if you do it twice, it should be fine. It's a temporary measure. But think about blowing up a balloon. If you blow up a balloon and then you let it go, it expands, right? The same thing can happen to your skin. The area under here is very sensitive anyways. So if you just do the fat grafting and the fat repositioning, number one, over the long run, it's going to be more economically feasible.
Perfect.
And it's going to last longer. It's your own natural fat. But there's a catch. You can't just do it once. 2 times is good enough. What happens is that when you graft fat into your body, about 50% or so, sometimes 40, sometimes 60, it ends up reabsorbing into your body. So what you need to do is come back a minimum of 3 weeks, preferably 4 weeks or more later.
Okay.
And it takes just about 10 minutes. You don't even need to go to sleep under sedation. The doctor pretty much injects you with the fat and grafts it on and pushes it into place. And if you do that, you end up with a survival rate of 70 to 80% usually, give or take. But that's the goal of what you're going for. So if you do it just once, you can expect about half of the result that is possible. And if you do it twice within 3 or 4 weeks, you're going to expect the full result. Fat can last up to 3 months, so you can store it at the clinic, but you need to come back within 3 months to do the second procedure.
So what about for those who come to Korea and only have time to get 1 session done and not get the second one?
Well, if you only have time for 1 session, you can still get the treatment, but what'll happen is 50% of the fat will be gone. It's still a 50% improvement over what you started with. If you want the absolute best results, you're going to need 2 sessions. But if you don't have a choice, if you're just coming for like a week, you're going to get a 50% improvement over what you have, which even like a 10% improvement on your face is gigantic. You know, we put on creams and stuff like that, and because we work in skincare as well, and there's really minimal improvement, like a 1% improvement with that stuff. So if you're talking about a 50% improvement, it's still a dramatic difference. But again, if you want the best result, if you want to hit that 70-80% improvement range, then you're going to need 2 sessions.
Okay, sounds good.
When you contact us, we'll be able to explain this from beginning to end. And then when you go in to see the doctor, you'll have a lot of knowledge base.
The only one thing I'm worried about is the recovery, because I do have very fine and delicate skin. So the recovery, I heard, is around a week or more usually, right?
It depends. When we did her skincare, her skin got pretty red.
Yeah.
So her skin is very sensitive. She might get a little bit of bruising when the injection point happens, but you can say a week or so and you can cover it with makeup. But if you have any bruising, it could take 2, 3, even up to 4 weeks to fully heal.
Okay.
So you can think I'm gonna need makeup, but I've seen cases where they just have like a slight little indentation and then they're fine. In my case, I had a little bit of bruising. Let's not expect that. Let's expect the bruising, and then we'll have good expectations going in.
I can say I was in a fight.
One last thing. Where are you from?
I'm from Canada.
Go Canada.
Thank you so much. I can't wait.
Good. You ready?
Yep.
Okay, let's go.
First of all, this clinic made me feel much more comfortable, and the doctor was super kind. He really took his time to explain to me more about the procedure and what can be done, and the benefits and whatnot. And he didn't rush me out like other consultations have before, so I found this to be a much more pleasant experience.
We'll start by changing you into the surgery gown. Please follow me. So for the surgery, you need to remove all the accessories to the metal on your elbow.
Password. The first thing we need to do is to fill out the clinic chart today. So you can take this and you can start by writing your name right here. After that, you can just write your passport number here. And over here, your phone number.
And we'll start by taking some before photos. Please follow me. You're gonna have a seat on this stool with your feet on the ground. Please look at number 1. Are you taking any medication or vitamins at the moment?
I take vitamins, but I was told to stop for a week prior. So,
Can you please explain to us what kind of treatments you're looking to do today?
fat repositioning to get rid of the dark circles and puffiness.
So for the fat repositioning, we're going to focus on evening out the fat underneath the eye. And with the fat grafting, we're just going to add some additional volume here to make your face a bit more youthful.
Sounds good.
After any type of procedures, there are some risk of inflammation infections. So in order to prevent that, we're going to provide you with some prescription medication, and we'll explain to you how to take it when you discharge. Okay? After the procedure, it's very normal to feel some numbness in the surgical area, and it's going to take a few months for the sensation to fully come back. And when that happens, you might feel like some kind of like tingling in the area. So if that happens, don't worry, it's very normal and part of the process.
Okay.
While it is possible to get fat from the stomach, the fat in the inner thigh is actually more stable and has a higher survival rate. So we only are going to do like a very slight puncture point on the hardest area, but on the face itself, because we're using a very fine needle, you won't have any stitches or anything like that. You might just have a little bruise where the needle went in. The scarring, particularly on the hardest area, is going to be a bit more visible for the first 2 months or so, and then it's going to fade to more natural skin color over the next few months. Scarring fade away a bit faster and smoother, then you can also use some scarring ointment about 2 weeks after the procedure.
Okay.
Because if we do the stomach, the puncture point is going to be inside of the belly button, or for the inner thighs, it's going to be in the panty line. So if you're wearing like a bikini or anything like that, it's not going to be visible.
Oh, okay.
So in case of fat grafting, the survivability is about 40 to 60% depending on the cases and on the patient. So the surgeon will put as much fat as possible, but please keep that in mind. If you want a retouch, you can of course do a second session afterwards. So from the under eye fat repositioning, because you also have a little puncture point inside of the conjunctiva, you can have some either fluid or blood coming out. So it's normal and part of the process, but if you feel like it's excessive or if it happens, let's say 2 weeks after the procedure, please let us know. For the first 2 weeks, avoid that, and afterwards you can start, but very lightly, so nothing like too heavy, because you would increase blood pressure, and that is going to cause the recovery process to take longer, and potentially some complications as well. The impression that you have dark circles, but it's not going to treat the pigmentation itself, so this is something that you need to get treated afterwards with.
You ready?
Yep.
Okay, let's go to the consultation.
화장실 가는 거 같은데요?
This is the area we're gonna put the fat. Do you want to? We're gonna remove the fat from here, and in this area we will fill.
Okay.
Okay, good. That's it. 이제 물.
아예 안 마셔.
네.
못 마셨어요?
못 마셔요?
알레르기 때문에.
네. 콩 알레르기나 뭐 우유 알레르기.
Any more allergies?
Just
Sorry?
like I can't drink regular milk or ice cream, but I can
우유 마실 수?
pasteurized.
아이스크림 먹을 수 없어요.
네. 저는 아이스크림 안 드리니까.
So we have to step back. It might feel a little, with the straps on, but it's just so you don't move. The doctor's going to come in a little bit, and that's when the anesthesia is going to go into your body. When the anesthesia goes into your body, the doctor will let you know, and you count back from 10. 10, 9, around 8 is when I usually fall asleep. And at that point, the doctor's going to inject you with local anesthetic underneath the eyes, and you won't feel any pain. Then he'll bring you back out, and you'll be in a kind of twilight anesthesia phase, and he'll give you more anesthetic once you need it.